morning, everyone. I'm Megan Cullip, along here with Scott Micklin.
Good morning, Megan Cullip. It's good to see you.
Always good to see you.
Thank you.
Yeah.
Welcome, everybody, too. Good to see all of
Yeah,
you.
also you,
by the way,
listeners.
audience,
Yeah.
right, that we know are tuning in for the COVID-19
We hope are tuning in.
local information program. Exactly. We get a few notifications,
We
right?
do.
And we see the messages. Good morning.
Yes.
See, it's on the
I
screen.
know, and we see.
Thank you.
Good morning. Looking forward to learning something new.
Oh. Well, no pressure.
We try.
Yeah, we're going to try. As we get started, though, today is Wednesday, June 3rd, by the way, everybody. This is the, 11th week?
Oh, my God. It's the 12th.
Deja vu all over
Oh,
again.
jeez.
But we wanted to mention about yesterday's show.
We did.
Where apparently I could not remember it as the 12th
Yeah.
week. But the show ended very abruptly yesterday because of the city, mostly citywide, or at least major part of the citywide power outage. And it hit San Juan College. And so obviously all of our fancy computers and lights and streams and everything else we were sitting here in the dark.
We were.
We talked for about 5 more minutes before we realized that there was no show.
Yeah. So tell us more about. Just
Right.
completely shut down.
Our guest, poor Tom Yost, was left holding his golf club and didn't know what was going on. Poor guy.
Hello, Scott. Hello, Megan.
So we appreciate
anybody there?
Tom and everybody that worked with us on yesterday's show.
We appreciate you guys coming back.
Yes.
In spite of technical difficulties.
Yes, but we are back today and everything's, again, working.
I think the radio gods were disappointed because you couldn't remember the week.
Probably. That may have done it.
That's it.
That's enough. Take them down. Take them down.
Chances.
That's right. So anyway, on today's show, we're very excited because we have an interview with some folks from the local Department of Health to talk a little bit about the testing that they have been doing. We're noticing a lot more testing from the Department of Health been ramped up. In fact, I think Jeff Bourgeois mentioned that on Monday that the hospital isn't doing maybe as much of their external assessments.
Right.
Because the Department of Health has stepped up.
Stepped up, yes.
So
he did say that.
So that's exciting. And so we'll talk to them about that. And then we have friend of the show. Devin Neely.
That's right.
From San Juan County, calling in later.
Giving us county updates.
To give us an update on the county, which I think is kind of slowly reopening their offices to the public.
That's right.
And so that's exciting news as well. So there you go. So we have that.
So we have that.
To look forward to.
Yeah, exactly. Hopefully
if the lights stay on.
Cut off Devin. Ugh. That would be bad.
No.
We're not going to cut. Well, we're not going to intentionally cut them off.
No, we wouldn't do that.
That would be ridiculous.
Exactly. So I'm going to call up some numbers here in a second.
We can call up numbers.
Okay. So hold on. I'll let you talk for a minute.
We can talk for a minute.
You talk about the sunshine or whatever you want to talk about.
Well, I did. Well, I'm going to ask the docs today about that. Speaking of sunshine.
Okay.
Because there's a question, of course, about seasonality with this disease. And we have been warned, take off your influenza lens because this is not influenza. And, typically respiratory viruses change with the season, but they don't know that yet about this one. And some theories suggest that it might not be related to heat and humidity, but vitamin D.
Oh.
Yeah, that we are healthier when we have vitamin D, and that by the end of winter, which of course you remember that was the major onset of this illness, we are at our lowest in our vitamin D in our body.
Interesting.
So I'm going to ask the docs something like that.
Okay. And the point being that we're going to have the docs on tomorrow.
Correct.
We're talking to them today because of their schedule, but they'll be on the show tomorrow.
Right. So I'm already gearing up.
That's what you're talking about. Just for the audience to know where that's coming from.
So yes, if that was a cliffhanger.
How Megan's mind works.
Yeah, we can have a whole
That's another show.
On that.
Is a whole
How
other
does this work?
That's Saturday morning.
I'm going to donate it to science.
Wow.
Yeah.
Okay. There you go.
So.
Well, anyway, let's take a look at the numbers from, again, the Department of Health that we share on ksje.com. The latest numbers came in yesterday, of course. 7,800 cases now in our state. Another 113 from around the state yesterday. San Juan County had another 37 cases for a total of 1,771. 6 additional deaths in our state, and that includes 2 here in San Juan County, and of those, we have 35 more recoveries, and that's approaching almost 3,000.
Good.
So that is good. So we appreciate that, and then we have the numbers, again, detailed of what we've gotten. So that's where we are. And you can see the Navajo Nation numbers there. I don't know if we updated that from yesterday, so need to work on that.
Okay.
So, but yeah, so there you are.
There's the numbers.
There they are. And again, tomorrow on the show, we will be looking at the numbers that the county compiles again, because they are doing those 7-day averages, and those are a lot easier to kind of see the trends and the curves flattening and all those things that we want to see. That keeps things reopening.
Yes, very
in our
helpful.
corner of the world. So so that's important as well.
Our phase 1 corner of the world.
Yes. So we're excited about that. So there you go. Interview,
let's do it.
With our folks, our guests from the Department of Health here in San Juan County. And so we talked to them yesterday again because of their schedules, but we're glad to bring that interview to you this morning. So here we go. Joining us now to talk a little bit about the upgrade in testing that's being done here in San Juan County with the coronavirus and COVID-19 from the New Mexico Department of Health here in San Juan County. Christina Morris is joining us. Good morning, and thank you for being with us this morning.
Thank you for having me.
You bet. You're very welcome. And also Renee Vukovic is with us as well, also with the Department of Health. Renee, good morning to you.
Good morning. Thank you.
Thank you both for joining us, and we're glad that you are with us. So we wanted to ask a bit about this kind of increase, at least it seems to me, in testing capacity that your department has kind of ramped up for the northwest part of the state. And has that been kind of by design, or just as tests became available, or kind of what's behind the recent testing events that we've been seeing advertised?
The reason we started the mass testing events is because we realized that we weren't hitting the whole community, but we also started to grow because of the availability of tests. So it started out kind of slow as far as accessing tests, but then we got the tests, and then we got rounded up, and we started doing the mass testing.
So what kind of tests are we talking about? I mean, because we were talking to the listeners a lot about antibody tests, and then the swab tests, and then some of the tests that involve a swab or through the nasal cavity, and some are back of the throat. So I just think it's helpful to be real specific about what kind of tests you guys are offering.
So the testing that we are doing, depending on what we receive, has been nasopharyngeal. That's the nasal. We have oropharyngeal, which is in the back of the throat. And we have been trying to use the buccal, which is inside the cheek, but we are simply testing it for how it's, sorry.
That's all right. Those are the active virus tests? Is that what these are?
Yes, it's for the efficacy of that test for sure, because we're not completely convinced that it's getting all the cells.
I see.
It's the easiest, but it's not necessarily the best.
Got you. Understood. And then the turnaround for the results for these tests that you're able to do, how long do folks need to wait before they can find out what the results are? Because I know that can be somewhat trying to wait until you know what the test says, if you're positive or negative.
Yes, and we do understand the frustration of clients who are trying to find their results. It started with as 2 to 3 days, and then as we did more testing and more expansion, we started using another lab. When we started using the other lab, it started to slow down a little bit more as far as results. So we're saying now 5 to 10 days. But now we're back to just one lab, so it should be anywhere from 3 to 8 days.
Great. And I noticed that to register, it says bring a cell phone, right? And so I'm wondering, is that for tracking purposes, and then what does that look like?
I will let Christina answer that, because that's the department she does.
Great.
Okay. Christina, Can you chime in on that one?
Yes, the purpose for having the phone call-ins is to reduce the contact. So we are registering folks for so they can have on their vials the contact information for how they receive the information. So the lab also will have the information as well. And so the information for the phone calls is, first of all, they register, and then second of all is to reduce the contact. So everything is by non-contact.
Got you. And these, go ahead.
I just want to wanted to address the part about the kind of tests that we're doing and the reasons why I think you're hearing a lot about the serological test of antibodies is that you may have heard a lot about that, about the blood test that the body's fighting, but the antibody is not recommended to decide if someone has COVID-19 because it takes your body a few weeks to produce enough antibodies in the blood to detect them. So by the time your body's producing enough antibodies for a blood test to detect, you may have been sick for a couple of weeks, and or you may have already felt better. So the nasal swab tests and the other tests are a lot quicker. And also a negative antibody test cannot be used to tell if someone did have COVID-19. So although there's purposes for a serological test like that and the other tests that we have, they're all very needed, but some of them we're still in the beginning phases of understanding of what the purposes are for use, and they're all very important. It's just for the needs of it is not necessarily advancing how people are getting the results back or how are they feeling at the moment.
Right. Understood. And so, and the tests these days, are they fairly accurate? I know we were hearing some things maybe early on where maybe some of the tests weren't as accurate as one would like, but it seems to me that those have been worked out, and the tests that are being given these days now are pretty accurate. Is that what we're seeing?
Yes, we believe they're probably 95% accurate. And they get the cells, they get the active cells, and the results are showing up much more quickly, as Christina said. Where with the antibody tests, we don't know yet how long those antibodies stay in the system. We don't know if it's going to be a long-term thing, or like measles, if you got the vaccine and you wouldn't get the measles, but we don't know how long this is going to last.
Sure. Well, and if you did, we would love to talk more with you about that,
yes,
because
yes,
nobody knows. But that's true. And so let's talk about your schedule that you've been ramping up testing. I know that folks can always come to the Department of Health office in Farmington for services, but you've got some tests set up at other remote locations this week as well. Is that correct? We
do have remote. We are no longer doing them at our office in our parking lot because the traffic became a problem. That's the only reason.
I see.
We have started testing starting at 7 in the morning because as it gets hotter, for several reasons. We have people in PPE that are just going to really be hot by the time 10 o'clock comes, and also people waiting in the car for their turn. Their cars are going to overheat, they're going to be heated up, and the test kits have to be at a certain temp. So
I see. Okay.
We really wanted to make sure that we're giving the access and the opportunity and availability for communities to get tested. So it's usually at the behest of the community if they're asking us to test here or there. And if it's with Navajo Nation, that's kind of above our heads. So it's more of a government to government relationship. So that request comes from Navajo Nation. Should that happen, we have tested. We started at McGee Park. We went to Shiprock in partnership with IHS and Navajo Nation. Since then, we did go to public health office here, but because, like Renee mentioned, our traffic couldn't meet the demands of traffic control. So we, with the strong support of Someone College and Judy B. Nelson in Kirtland, we have, for the past 2 weeks, this is our second week of mass testing in communities.
Right, and we're showing the poster on the screen right now. So the plan is kind of Monday and Wednesday in Kirtland at Judy Nelson School, and then Tuesdays and Thursdays have been happening here at San Juan College. Is that the schedule for at least this week, correct?
Correct.
Correct, and sometimes we will be called on point to have a test at a facility. whether it's a correctional facility or a state facility, we will be called out.
Sure, and that's important as well. And then I know that you've also planned for a test this Friday in Bloomfield at Nabaani Elementary School.
Yes, and we're also trying to, for the convenience of the community, to try to have testing locations in each of the Tri-City area for sure, and then including Kirtland. And so that's why we're going to Bloomfield, and we're trying to find a venue for Aztec, and we'll just keep trying to do that probably on Fridays, since the Judy Nelson and San Juan College are fairly fixed for now.
So those are going to be happening throughout the month
Yes,
on Tuesdays, Thursdays, Monday, Wednesdays, right?
correct.
Understood. Okay.
For right now, yeah.
For right now. Good to know. And so, and again, we talked to some of the other experts about the importance of testing and why this is so important to find out if there are hot spots still in our community, if there is still community spread, and we've seen our numbers improve, which is great. And I know folks get worried about, well, if there's more testing, you're going to find more positives, and won't that push the numbers up? But that doesn't work that way, right?
It
Yeah,
hasn't. Yeah. Go ahead, Chris. Sorry.
I think we want to go back to the purpose behind testing, and it is about this situational awareness about why and the purpose behind it, the diagnosing for individuals, whether folks are in the active infection stage or early late in its course. Are they contagious, or who will be contagious? If not now, when? And then, of course, there's that prognosis piece, the severity, the complications, the clinical needs, and the acquired immunity after that timeline has transpired. And then and then it's considering the fact that that we are looking at detection. So what is it, and how do we seek to detect it, and how? So those measurements are looking at the virus and then the host. So we're looking at also the interaction of population, who is infected, who is immune, and who's acceptable. And then, of course, where in space, so the geography and time, and understanding heterogeneity, who and why, and across space and time. And then, of course, the accessing those interventions. So there's just a lot to the situational pieces that understanding the science behind it is a lot of moving parts.
Sure. And I want to go back to the Aztec testing site. So if somebody had a venue idea for a site in Aztec, do they just call your office? Would that be helpful?
Yes, they can speak with Rita Aboud.
She's our branch director for this, the COVID-19.
Okay. And is there a phone number they can call, or what's the best way to reach out to Rita?
Yes, you can call her at 505-327-4461 and ask for Rita.
Okay, perfect. Well, we thank you both very much for joining us this morning to talk about the role the Department of Health is doing here. And, of course, you report all your findings to the State Department of Health, of course, and which is where we get all these numbers that we hear about every day. And so we know it's a cooperative effort. There are other offices like yours throughout all the corners of our state that are doing this work. So thank you both very much for joining us this morning.
Yes, and you're welcome. And just to leave you with some important phone numbers, the hotline numbers for the coronavirus, for folks who can call in who don't have internet access can call about their symptoms or need to speak with a nurse, and can call 1-855-600-3453. And for non-health related COVID-19 questions, they can call 1-833-551-0518. And for folks who want to know more information, they can go on to the website at https://cv.nmhealth.org. And there are other websites they can go to, such as the New Mexico Community Data Collaborative Maps. That is at www.nmcdcmaps.org. And that's put on by the partnership with DOH and the Center for Health Innovation. And then those are just some really cool websites to go on to. And of course, the https://coronavirusjhu.edu. That is the Johns Hopkins University maps. So I think a lot of there, they can see a lot of the zip codes and kind of the hot zones, in not just in New Mexico, but across the country, and
Right.
global maps as well.
No, those are great resources. Thank you for sharing those. So perfect. Well, thank you again, both of you, for joining us, and thank you for being kind of on the front lines of all this for the rest of us. We appreciate the work that you are doing, you and your colleagues at the Department of Health. Thank you very much.
Thank you.
Thank you. We appreciate you.
Thanks so much. Our guests this morning from the Mexico Department of Health, Christina Morris and Renee Vukovic with us.
Doing great work.
They are. And we are back here in the studio. Thanks to our guests from the Department of Health. So
We've been trying to get them on for weeks. And
we
so
have, so we finally got it.
we
The
finally got
planets
it.
aligned, and we
That's
got
right.
them.
Dreams
So,
come true.
That's right. So, and again, as I mentioned, more testing in the communities. So again, here today, Wednesday, wrapping up in Kirtland. Tomorrow, Thursday, back here at San Juan College. Again, Friday over in Bloomfield. So
That's right. And there has been a quicker turnaround on tests. Now it's a 2 to 3 day turnaround
for the results.
for the results. And
Okay.
it used to be a lot longer.
That's right.
So
So that's good.
I know. It's amazing how fast technology can improve when we're under extreme duress.
Well, true. And I think it's been a push by the state, too, to try to get testing out to all areas of the
sure.
state. We saw the numbers in Bernalillo County. They had a lot of tests very early on, but our part of the state, not so much. And now I think we're trying to catch up with
Catching up.
those other population centers. And again, I think there's maybe a goal to try to test everyone who wants to be tested in our state, which would be good.
That'd be great.
Moving forward.
Moving forward.
So there you go. So we're excited about that. So we appreciate their time to talk with us, because I know they're busy. Those ladies are parts of these testing events that are happening. So that's why it was so hard to kind of track them down and
Right.
and be able to talk to them. So we know they're busy.
We do.
We appreciate that. So there you go. Next up, we're going to hear from Devin Neely, is who we think, right?
We think.
You're going to call in.
You should be calling in.
Okay.
Devin, if you're listening.
Devin, we're ready for you
Call in.
if you're listening. But in the meantime,
In the meantime,
Yeah,
yes,
sure.
I was learning things this morning.
Were
What was I
you?
learning
I don't
about
know.
the coronavirus?
okay.
I mean, but again, these are questions we're going to ask the doc.
Yes.
But there's a constantly evolving understanding of the virus in children. So that's a very
Sure.
interesting thing.
Right.
And there's also a constantly evolving understanding of surfaces, how long it stays on surfaces, which impacts summer plans. There's a lot of talk on what is appropriate, what is not appropriate to do this summer, or what is safer. And
Right.
so, you
Okay.
know, but you know,
There's all that.
there's all that. Things have opened, like the hair salon thing. I believe
Right.
that you
I need one.
need one.
Yes,
I could see that.
Thank you. Hey, come on.
You got the hippie wave.
There's a
It's
lot.
like Young Scott.
There's a lot
I've seen
there's a
pics.
lot of product happening to keep everything under
Ooh,
control.
So it's like a helmet effect.
Oh, always, even more so than usual. So
I can tell.
yeah, thanks. Soon, everybody. Yeah, tomorrow. Haircut.
Just in case you're worried.
Yeah, there you
Because
go.
we don't have any airbrush techniques going on.
No, this is it. This is kind of,
This is all we got.
this is it. There's not a hair and makeup division at KSJE for the video.
Gosh, that would be amazing.
Right? Wouldn't that be great?
It would.
But no, not so much. So
Don't get your hopes up. We are grant and listener funded.
that's right.
We are
Exactly.
community supported radio.
We are. This whole thing, this whole show, this whole station is supported by the community, which we definitely appreciate. So thanks, everybody.
Yeah.
And you can find out how you can support us on our website, and it's right there on the link underneath the video. So we encourage you to check it out. So
Yes,
we appreciate
do it.
that very much. So, oh look,
Oh, look.
someone is called.
Devin's like, oh, God, they're floundering.
Someone is called on the phone. Good morning. You're on KSJE.
Good morning. It sure would have been helpful had I known the number to call you.
Oh, the number. Once again,
the number.
The booking staff did not provide the number to call in.
I was the booking staff this time.
Yeah, which when Megan checks her phone, she'll see a couple of text messages.
Oh.
And you too, Scott, actually.
Oh, snap.
Oh,
from me
well, there you go.
asking
Oh, look.
for-
There it is.
Oh, look, Devin Neely's trying to get
wow.
on.
Oh,
okay, cool.
I have to unblock you to get
What's
your messages.
the number? Question.
wonderful.
What's the number? Exclamation, exclamation,
Poor
exclamation.
Devin. I'm so sorry.
Cool. Okay.
Well, anyway.
Sorry, dude.
On the phone is the very resourceful Devin Neely from San Juan County. Welcome, Devin.
Good morning, and thank you both for having us. It's been a while since we've talked on the COVID program.
It is. And so what's been going on with San Juan County? Can you give us an update?
Well, recently, obviously things have sort of evened out. We aren't seeing the constant change as we once were with our current incident, our situation with the COVID-19 here in the Four Corners. But the biggest update, the biggest change in our world right now is the latest order from the governor's office that has once again changed the way that we're doing operations. And until just Monday, San Juan County offices were closed to the public, and you could still conduct business over the phone, over email, over the internet, things of that nature. But now our buildings are open once again, and that was obviously very helpful with the election, which took place yesterday. But now county facilities are all open to the public once again. We do highly recommend to call ahead if you have business at the county. Sometimes you can do that over the phone still, or over the internet, just to reduce the number of people in and out of the facility, and that's a protection for the public, and that's a protection for our employees. We still have a few folks that'll be working from home for a little while, but everything we do is to protect our employees and the general public, and so now with the doors open, we will continue to provide those services that we've been providing the whole time.
Very good, and that's important. And of course, the county's still on its 4-day-a-week schedule too, right? You're normally not open on Fridays.
That's correct. A lot of administrative offices are on a 4-10 schedule, working Monday through Thursday, and then there are other peripheral facilities that are either open 5/8 or they're 24-hour operations. Our first responders are obviously always working, but maybe the front offices that serve those first responders are on a little bit different schedule. So if you have questions, you can always check the county's website, sjcounty.net. Wow, I just blanked.
Whoops.
We've been doing it all morning.
Yeah.
Yeah. Or you can just call ahead and double check to make sure that the facility that you're going to be visiting is open, and there aren't, but we do, of course, in line with the state's public health order, encourage everybody to wear a mask in our facilities, which are public. At this point, our county commission meetings are not open to the public because that is in violation of the mass gathering ban, and we are still doing our best to limit the number of people in county commission facilities. But as such, we are providing the county commission meetings streamed online through YouTube, and you can participate through the WebEx
Okay.
as well if you want to participate in a county commission meeting.
Well, that's good to know, because again, I know a lot of discussions about open government and public government, and the public has a right to can still ask questions, right, if they wanted to. Absolutely. During these meetings, and that's how they would be able to do that in this new online world, right, Devin?
Correct. Yeah, and we publish our meeting agendas every Thursday preceding the meeting, if the meeting's on a Tuesday. And so you can go to sjcounty.net and you can see the meeting agenda. You can see what's going to be up for discussion. There are multiple ways to give feedback to commission. You can there's a form online you can fill out. There's an email address. There's a phone number. There's an address, a physical address if you'd like to drop off or mail, mail a physical letter of your comments to commission, and then those comments are all read during the commission meeting and submitted to all of our commissioners for their consideration. So we've done our best within state guidelines with OMA, the Open Meetings Act, and through guidance from the Attorney General to make sure that our meetings are still accessible. But we are currently not encouraging the public to attend in person.
Good. So switching topics dramatically, Riverview is owned by the county. Let's talk about the golf course. Have you been hitting the links, Devin?
You know, I have not been out to Riverview since we reopened, but we did get to reopen, and we're really excited for that. Riverview is a beautiful 18-hole golf course out in Kirtland that is run by the county, and we had a lot of time to make sure that the greens are in tip-top condition. We're back at full capacity, but we are abiding by the state's CSPs, those COVID-safe practices, which are there is a whole section specific to golf courses, and one of those things is the availability of tee times solely online or pre-booking over the phone, and that's as a goal. The goal of that is to reduce foot traffic in the pro shop.
Right, sure.
You know, we want people out on the links and social distancing as best they can. There are some guidelines as far as who can share a golf cart, and the rest of you will get your own individual golf cart. And Rio Vista Grill at Riverview Golf Course is still not seating folks inside, but you can get your food to go, and there is a nice big patio, and as long as you limit the number of people on the patio, you could enjoy your lunch out there on the patio too.
That's great. That's just a fun summer activity to do.
Start talking about food and you got both of our attention.
Right, we're like, ooh.
Oh, food.
Initially, we're like, oh, they're not serving. And then you're like, oh, they're not serving inside. We're like, oh, never mind. We're open again. And I get my personal golf cart.
Maybe.
Yeah.
If you play the cards.
They trust me with a golf cart out there.
Well,
I think there's rules about driving directly onto the green.
there may be a deposit required for you.
Just for me.
Just saying.
Just for me.
Yeah.
So switching gears dramatically again.
So much drama on the show this morning.
It's all
wow. All right, where are we going next?
We are going to
buckle up, Devin.
Yeah. Well, we've had some inquiries about court proceedings. Like, are they in person again? Are they still being conducted by the phone?
I don't know. That is a question for someone that works in the court.
I can answer that, Devin, because my guest at 8:00 was District Attorney Rick Tedrow. And so
a guy that would know things.
Mr. Tedrow said that the state is starting to have in-person trials again, jury trials. They're starting back up. They actually are phasing it in over the next few weeks, and they're starting in the Alamogordo area. And every judicial district has to come up with a plan of how they're going to do this. And so the plan for San Juan County and McKinley County would be to maybe restart and phase in the face-to-face jury trials in July.
Okay.
But the talk was about, how do you do that? How do you pull a jury pool, right? Because you have like dozens of people that show up to be selected for a jury. So maybe you have to do that now, maybe in a school gymnasium to have everyone separated out to decide how to do that. So we talked about that this morning. You can find the interview, actually, everybody, on our YouTube and Facebook page.
Could you imagine what jury duty is going to feel like now that you're in a hot gym?
I don't know.
I still believe in my civic duty, though. I love it. I sat on a really intense jury one time.
Okay.
So.
Well, thanks for that.
Yeah.
Little
all about
teaser.
The law and
now
order.
We know more about Megan. Why she is the way she is.
Progressively more and more.
Devin, before we completely ignore you, was there anything else that you wanted to share with our audience today? It's exciting to know that San Juan County offices are reopening if folks do need to do face-to-face business. But again, the best advice, as you've mentioned, is to call the specific department to maybe make an appointment before just showing up there in Aztec, correct?
Correct, and that's our hope. We know that there's going to be opportunities that you end up in Aztec and you just happen to have whatever you need to do with you. But most times, if you plan a trip to Aztec, you can also take a couple of minutes and just give our folks a heads up so that they know that you're coming. They can be prepared. That way we can have, the countertops and the door handle sanitized and ready for you. Our cleaning crews are doing a fantastic job of keeping the building sanitized and clean. I don't think that we really realized how essential our cleaning crews were until recently, and they do a great job, and they're doing even more work than ever right now to keep up with the constant sanitization that is necessary. And, obviously we saw a lot of foot traffic yesterday for the election.
Right.
Mm-hmm.
Sure.
And we were glad to see that, and our election workers worked very hard to keep our folks safe and keep the public safe. And, my hat's off and commendation to the clerk's office and all of her staff and all of the election workers and frankly, everybody that participated in democracy yesterday. Whether you participated via mail-in ballot, absentee or early ballot or whatever, or you showed up in person, got yourself a little sticker, I commend you for doing so, and so does the rest of the county. So.
Wonderful. Well, thank you. And again, yes, thanks to the poll workers. And I know we'll see it again in November, Devin Neely. And so it's important to keep these things moving forward.
Well, we'll see where we're at in November. Hopefully it'll be like, back to business as usual.
Really?
Maybe.
Okay. I like your positive attitude. And I mean, yes.
Well,
that would be nice.
I think
I would hope so too.
I was going to say, I think there's evidence to suggest it might.
Well,
unless we get the second wave.
You know what I'm going to say is stay tuned, everyone. We'll maybe talk to our doctors about that for tomorrow's show.
Mm-hmm.
How's that?
Tease.
There you go. Devin, thank you for calling in.
Thank you, Scott and Megan. It's good to hear from you both, and stay well.
You too. That is Devin Neely, everyone, the Public Affairs Administrator for the San Juan County government, and we appreciate him calling in. Now that he figured out what the number is, why don't you save that number on your phone?
Save the number on your phone. Well, to be fair, don't we usually have a ticker that has it?
Sometimes we turn the ticker on to get folks to call in, but nobody's called in. We've invited folks to call in.
We still would like you to call in.
We would. We'd love to hear from our audience.
We want to hear how you guys are doing out there.
So we can do that maybe tomorrow.
Yeah.
Or now. I mean, I'm not saying if someone called right now, we would go to the phone, but we would.
Phone call.
But we're almost done with our show today.
Yeah, but that's on me. I feel I should have said, by the way, the number is...
Right.
566-90... Nope. Maybe I should say that number.
566-3909.
Gosh.
There's a 3. And then it's 90.9.
That's what catches me.
3909.
That's what
566-3909.
Right.
There you go, everybody. So
that 3.
If you'd like to call in tomorrow, we will look forward to your call.
Yes.
Everyone. But for today, I think we're done.
I think it's time to wrap this up.
I think
before
so.
the power shuts us off again.
Right. Maybe the forces beyond what we know could shut us down. Who knows?
Who knows?
Because we don't know what caused the power outage yesterday.
It is a mystery.
It's been disclosed.
It is a mystery.
Maybe we should call Georgette Allen at the city to find out what took us off the air.
She's like, I took you off the air. I was listening.
She called the utility and said,
time
cut it.
To take you off the air.
Off the air.
They have jumped the shark.
Wow. Let's hope not.
We should get Georgette Allen, though, on again.
Yeah.
She's delightful.
Right. Well, when you book her, make sure you give her the number.
Okay. Be ready, Georgette.
There you go, everyone. Thanks for watching, everybody. Stay safe and well. This is KSJE, and we'll see you back here tomorrow.